Hello, and welcome to Fit to a T. This is a program that has been designed by the United States Bone and Joint Initiative to help educate people about bone health and osteoporosis, including ways we can screen, prevent, and treat the disease. So let's meet Sylvia. Sylvia is a Latina woman in her 50s who just slipped and fell on her rug, breaking her wrist. Her doctor sent her for a bone density test, and she was diagnosed with osteoporosis. Sylvia was extremely surprised because she thought she was too young to worry about a disease such as this. However, her and her doctors are now working on reducing her risk for future fractures through diet, fall prevention, exercise, and medication. So this is an example of what can happen so easily and impair someone's quality of life. However, there are treatments for osteoporosis that we will learn later about. Let's take a look at these two types of bones and learn the definitions about osteopenia and osteoporosis. Normal bone actually appears as very thick trabeculi. You can barely see through the bone. Osteopenic bone is the next stage where the bone is starting to get weaker than normal. You can start to see almost little holes through the bones, and these patients can still be at risk for breaking a bone even with low trauma. Then it can progress to form osteoporosis. This literally means porous bone, or bone that is very weak. There's many perforations, and literally that person does not have as much bone. So these are examples of the differences of how bone loss can progress. Another term to also learn about is osteoarthritis. Sometimes this is confused with osteoporosis as the two words sound the same. However, osteoarthritis is a disease that causes degeneration to the joints, so the cartilage and the tissue between the bone, whereas osteoporosis is a disease of the bone itself, causing weak and porous bone. Now let's look at the life of our bones. So as you can see with this graph, we are actively building very good bone up from our teens, our 20s, our 30s, up until about age 35, where we build what's called your peak bone mass, or the most amount of bone that you will build in your life. Then, after that stage, we slowly start to lose bone, with the period of most rapid loss being between age 50 and 60, which for women is when most of us go through menopause. Then the bone loss does continue, but it is at a slower rate. So it is important, as in our younger years, to try to practice behaviors that will help to increase our bone as much as possible, including good diets, active exercise, staying away from excessive alcohol or smoking, so that way we can build the most bone that we possibly can, so then as we start to lose later in life, hopefully we will never get to the osteoporotic stage. Osteoporotic fractures occur most often in the hip, wrist, and spine. More than 2 million fractures happen every year in the United States due to osteoporosis. This is a staggering amount. The most common fractures occur in the spine, accounting for approximately a third of all fractures. The next most common are the wrist, which account for approximately 20% of all fractures. And the third most common are hip fractures, accounting for approximately 15% of fractures. Unlike most serious conditions, osteoporosis doesn't hurt or cause other symptoms until you break a bone. That's why it is sometimes called a silent disease. There are many risk factors for osteoporosis. Some things can be changed and others cannot. Known risk factors include not getting enough calcium or vitamin D, whether from our food or supplements. Also, other comorbid conditions such as diabetes, hyperthyroidism, or breast cancer can also be risk factors. Any patient who has gone through radiation or chemotherapy could also be at higher risk for osteoporosis. Lifestyle factors such as smoking or excessive alcohol use or a sedentary lifestyle can put someone at risk for osteoporosis. Also, our age, being older, our sex, being female, or our body size, having a lower body weight, can put us at risk for osteoporosis. Family history is also important, as this can be passed on from generation to generation. An important point to make is, why did a fracture happen? Most often, osteoporotic fractures are caused by very little trauma. We often call these fragility fractures, or basically a fall that happens from standing height, such as tripping on a rug or falling in the yard, and a bone then breaks. This is an alarm. This is a red flag to the patient as well as their healthcare providers that this patient may have osteoporosis. Oftentimes these fractures are out of proportion to what you would think from such a simple fall. So if you have one of these falls from a standing height, you absolutely should be screened for osteoporosis. All women over the age of 65 and older, regardless if they have had a fracture or not, qualify for a bone density test. This is covered under Medicare. So it is important to distinguish if this fall happened from something very simple or if it was a major trauma such as a car accident or falling off of a ladder, for example. So what are some consequences of having a broken bone? There often are many. With hip fractures in particular, there is a much higher rate of mortality after a hip fracture, as this leads to a loss of independence, and over a third of patients who suffer a hip fracture end up having to need some type of long-term or nursing care, or require some type of ambulation device such as a cane or a walker. Wrist fractures are also very painful and may require surgery. Sometimes we don't gain full function back of that wrist. And spine fractures change the shape of our spine. Those bones never go back to their original shape, which could cause a hunched over type of appearance, which later then could cause trouble with breathing or pressure in the abdomen. So these fractures are extremely important to prevent if we can. That way a person can maintain their quality of life and their independence, which is so important because as we lose these things, it also can cause problems with our mental health, as our physical health and our mental health go hand in hand. And it is often a very difficult transition for somebody who used to be able to do everything themselves to then now all of a sudden need help or assistance from a device or another person. So it is extremely important that we try to do what we can to prevent these fractures from happening in the first place. So what are some strategies to help prevent these fractures? You and your doctor should discuss these together. Some examples can be a fall prevention program. Assess what your home looks like and possible obstacles that could be there which would create a fall. Get tested. Have a bone density test if there is any concern. Make sure you're getting enough calcium and vitamin D. There may be some dietary changes you may need to take, or supplements that you may need to start taking depending on your diet. Assess your lifestyle factors. Look at if you are smoking or drinking excessive alcohol or excessive caffeine. See if there's something there that you can quit altogether or slow down. Exercise is extremely important. Develop an exercise program to help improve bone growth and prevent those fractures. And also medications if you need to. Assess the medications that you are taking. See if there are any that may be contributing to bone loss, as there are some. And then if you have been diagnosed with osteoporosis, consider the medicines that we do have, because they have been proven to help prevent future fractures. So how can we prevent falls? Falls do not have to be a normal part of aging. In fact, they are not a normal part of aging. However, they are very common. 1 in 4 Americans over the age of 65 will fall every year, and this is the leading cause of fatal and non-fatal injuries for older Americans. Falls are also costly in dollars and in quality of life. Annually, there are 3 million older people are treated in the emergency department because of falls. 800,000 of these patients end up being admitted. So how can we prevent these falls? Talk with your doctor about some strategies. The National Institute of Aging has recommended physical therapy, exercises such as Tai Chi, walking, and resistance exercises. So find a good exercise program. There are many senior centers and gyms locally in most towns that offer some type of balance class or yoga class or Tai Chi class. Review the medications that you're taking with your doctor. Some medications can cause patients to feel dizzy or off balance, and if that's the case, then those should be adjusted. Also, get your vision and your hearing checked annually and update your eyeglasses. Keep your home safe. Remove any loose throw rugs. Increase the lighting, especially in your bedroom and your bathroom. Make your stairs safe by having handrails on both sides, and install grab bars in key areas such as your bathroom. And be honest with your doctor with how many falls you have had, because we certainly want to help you and try to prevent any more from happening. If you have had a fracture, or if you are a woman age 65 and older, then you qualify for a bone density test. This is measured by an X-ray, and it is a very painless, quick test that will then help tell us how strong your bones are. The machine itself literally measures how much bone you have or how much mineral is there. It can then give us a score, which is called a T-score, that will classify you into a normal bone density range, osteopenia bone density range, or osteoporosis bone density range. And this then helps us assess what your risk is for a future fracture. So all women over the age of 65, regardless of risk factors, qualify for this test. In addition, all men over the age of 70 qualify for this test, and anyone younger than those ages who have risk factors, such as a previous fracture or a family history, qualify for this test. We also then can calculate what's called your fracture risk assessment, or FRAX score, and this is a measurement that helps estimate your risk of breaking another bone over the next 10 years. It takes into account your age, sex, weight, height, and bone density, in addition to any other risk factors you have, to give us a percentage of what your likelihood is of breaking another bone. So the bone density test is extremely valuable and gives us very good information. To have osteoporosis, your T-score needs to be minus 2.5 or lower, or more negative. The bone density test is recommended to be repeated approximately every 24 months or once every 2 years. We can often repeat the test sooner if it is clinically indicated. So let's talk about calcium and how we can get appropriate amounts of calcium from our diet and supplements. Calcium is an essential mineral which allows our blood to clot, our muscles to contract, and our heart to beat. It also compromises the majority of our bone and our teeth. Every day we lose a little bit of calcium, so we need to supply our body with more so that it doesn't start to leach it from our bones. The best way to get calcium is from our diet. This can be through dairy products such as milk or cheese or yogurt, or green vegetables are also a great source of calcium, such as broccoli, leafy greens like spinach or kale or collards. Canned fish can also be a very good source of calcium, such as sardines or tuna or salmon. There's also calcium in orange juice or other fortified milk alternatives, such as almond milk, which can be great sources of calcium as well. The amount of calcium we need depends on our age. Generally, most adults need between 1,000 and 1,200 milligrams of calcium each day. Now let's move to vitamin D. Unfortunately, there are not quite as many sources of food that contain vitamin D. However, we can get a large amount from the sun, as well as supplements that we can take over the counter. We recommend approximately 1,000 international units of vitamin D3 daily. Recommendations may be different if you have osteoporosis or have been found to be deficient in vitamin D. There are some foods that have vitamin D, such as egg yolks, some fish, fortified dairy products such as milk that says it has added vitamin D in it, mushrooms, and fortified orange juice. A note should be made about sunscreen and vitamin D. Sun exposure is an excellent way to get vitamin D. However, most sunscreens block the absorption of vitamin D. So we may need to have exposed skin to properly absorb the vitamin D. Of course, this should be taken with caution depending on people's health history, but a note to be made. We need only about 10 minutes of unexposed, unprotected sun exposure to absorb a proper amount of vitamin D. However, patients who are not able to do this should talk to their healthcare provider about supplementing over the counter with vitamin D. Now let's talk about exercise and helping our bones. Exercise is probably the most important lifestyle modification that we can make to help improve our bone strength. When we move, we are telling our bodies that it is being used, and so the more we move, the more new bone you will generate. There are certain exercises that are most beneficial for your bones, and these include weight-bearing exercises such as walking or lifting weights. Exercises such as yoga and Tai Chi are also helpful because they work on our balance to help prevent further falls. A regular exercise routine should be discussed with your doctor so you all can establish a good plan of what is safe and effective for you to do. Exercises such as swimming are not quite as beneficial for the bones, however, are wonderful for overall health. If you have been diagnosed with osteoporosis or are at a higher risk of fall, there are certain exercises we should avoid. These include exercises that involve flexion of the waist or forward bending, or exercises that twist or jerk the spine. It is oftentimes helpful to participate in exercises which allow one foot on the floor to remain at all times, so that way we do not lose our balance or have a chair or something to hold on to if we are prone to falls. There is no cure for osteoporosis, but there are medications that are approved to either prevent and or treat the disease. Medications are indicated for patients who have been diagnosed with osteoporosis, who have had a history of a hip or spine fracture, or who have a T-score which places them in the osteopenic range, together with a FRAX score of greater than 20% chance of major fracture or a greater than 3% chance of hip fracture over the next 10 years. There are two different classes of medications for osteoporosis. One class helps to slow down any further bone loss. The other class helps to stimulate new bone growth. Bone is a living organ. It is constantly being broken down and regenerated all of the time. The bone loss is attributed by cells called osteoclasts. These cells destroy the bone, and then osteoblasts create new bone. Anti-resorptive medications, or ones that slow down the bone loss, work by encouraging the osteoclast to die, slowing down the bone loss, but allowing bone building to still occur. The other class of medication, which we call the anabolic medications, work by stimulating the osteoblasts, or new bone formation. All treatment should be discussed with your physician. So we've talked about some red flags that could predispose someone to have osteoporosis, especially later in life. But what are some of these red flags that may happen in younger patients? Certainly, women who go through an early menopause are at more risk for osteoporosis because they have started losing estrogen at a much younger age. Men and women who have taken certain medications, such as steroid medications, chemotherapy drugs, immunosuppressants, anti-seizure medications, proton pump inhibitors, all of these have been found to increase the risk of osteoporosis. Other factors that can contribute can be our family history. If your mother or grandmother had osteoporosis, then you have about a 40 to 60% chance of inheriting it yourself. So it is important to know your family history. If you've had chemotherapy or radiation therapy for any type of cancer, you also could be at risk for osteoporosis. If you had a very low weight or suffered from eating disorders, especially in our teens or our 20s, you could be at risk for osteoporosis as well, as you may not have never achieved your peak bone mass, and therefore when you start losing bone, it may seem more dramatic because you never had as much bone to begin with. So these are all important things to know about your health history so that you can discuss these risk factors with your provider if you feel you should be screened for osteoporosis. Significant risk for osteoporosis has been reported in people of all racial and ethnic backgrounds and in both sexes. Ethnicity and race are important factors influencing the incidence of osteoporosis, which makes sense when we consider that heredity and genetics play a role. The highest risk ethnic groups are Caucasian and Asian American women. The next most high are Hispanic women. More than half of Hispanic women 50 years of age or older have experienced some kind of loss of bone density. The patients with the least amount of risk seem to be African American women. They generally have higher bone density than Asian American and Caucasian women. However, it's not to say that they are not at risk for significant fractures or impairment of quality of life. African American women are more likely than Caucasian women to die from hip fractures because these fractures tend to happen later in life, and they may have other health conditions at that point which could impair their healing and recovery process from that hip fracture. The incidence of osteoporosis overall worldwide is expected to rise very sharply over the next half century. So let's take a moment to recap what we've learned from this presentation today. What are the top 3 things you have learned from this session? What lifestyle changes will you make and/or actions take? So let's all recap together. Here are some of the key points that I hope you have learned today from this presentation. If you break a bone, that is a very big red flag. You are now at a higher risk of breaking another bone, and you must take action. Get tested for bone density. Make some changes to your surroundings to help prevent future falls. Make some changes to your lifestyle factors, whether that be incorporating more calcium into your diet, starting to take a vitamin D supplement, or assessing an exercise program that you can be consistent with. Talk to your family to learn the family history of osteoporosis, so that way this can be communicated to your healthcare provider. And if you break a bone and your healthcare provider does not mention or have a conversation with you about your bone health, please ask them. The consequences of repeating a fracture over and over are certainly very real and debilitating, so the more we can do to help prevent even that first fracture, the better quality of life you will have. And to end on a positive note, there are things we can do to help prevent these fractures. So hopefully you have learned many of these things that you can start to implement today, and this can help change your future storyline. Thank you very much for your time and attention today. The United States Bone and Joint Initiative thanks the Fit to a T Advisory Committee and our collaborating organizations. I hope you have learned some good facts about bone health, osteoporosis, and prevention strategies to help improve the quality of our bones and the quality of our life. Thank you.